Welcome, and thank you for joining this valuable education. My name is Sondra Reher. I am a nurse and birth worker, and I want to jump right in with some difficult and honest truths. That being that birth plans don't work. Instead, let's learn how to step into your authority and communicate your needs with medical providers properly using a medical care plan. Don't worry if this is something you have never heard of. That is what this course is all about. Now, I want to jump in and talk about some of the inadequacies of the stereotypical birth plans that we see in the birth community. Medical personnel don't have any incentive to observe your birth plan. A typical birth plan holds no legal weight, proposes no liability, holds nobody accountable, and I believe actually fractures the relationship between the medical provider and the birthing mother, who's not only trying to advocate for herself, but for her baby. Most birth plans present themselves in a way that is easy, quick to read, simple, concise, even cute or aesthetically pleasing. I'm going to let you in on a secret. That's no secret at all. Medical staff aren't stupid. They don't need quick or presentable or easy to read. They are fully capable of reviewing articulate and thorough documents. Here's what I see set up as soon as a mother initiates giving her care provider her birth plan: an immediate power dynamic shift. You are telling them that you don't wish to have complex conversations, that you don't view them as capable to communicate properly with you, and that you would prefer easily rather than fully informed. The birth plan is a form of passive consent, the exact opposite of what you want if you're looking to be an authority in your birth experience. I would like to first take a moment to breathe into our bodies before jumping into some important subject matter. You can do this in a way that feels good to you, or you can follow my prompts here. First, you can take a hand, put it over your belly, place it there, and take some deep inhalations through the nose, and then slowly out through the mouth. Let's do that 3 times for a count of in for 4 and out for 6. I'll give you a moment to complete this practice, to drop into your body before we move on to what this course is all about. Who is this course for? Women who are planning to or may consequentially enter into the medical system at any point in their perinatal journey. That means through pregnancy, birth, or postpartum. They may be seeking the care of a licensed professional or medical establishment at any time. This course is also for birth workers who are supporting women that may enter into the medical system. This includes routine or emergency care. So what this really means is that this course is for anybody. What are we going to learn? Self-responsibility and the power of a care plan and establishing authority over your care. We're going to learn about your patient rights, about medical providers, how they communicate, and what is liability to them. Establishing your perinatal desires, taking a birth plan and turning it into an individual care plan, as well as confidently creating your own care plan to share with your medical team as an editable PDF. I want this course to be concise enough that you can consume it within a reasonable amount of time and not feel overwhelmed, but thorough enough that you feel very confident in stepping into your authority if you want to enter into the medical system at any point in your perinatal journey. It is my belief that birth is not a medical event, but a completely normal physiological process that truly doesn't require medical management in the vast majority of cases. But there are also countless reasons why women may choose to enter into the medical system, some of which may be planned or emergent. They are completely valid for each woman, and she deserves the knowledge to navigate that experience confidently. You need to know that when you enter into the medical system to seek care from a licensed provider, you are opting in to being a patient. This is how you are viewed from a medical perspective, and though healthcare providers should work to make you feel individualized and witnessed, legally and plainly, you are still a patient. It may feel odd to be labeled as a patient when you have no health concerns at all. You're simply pregnant. But it is an important factor to understand as we move forward into discussing how the medical system communicates and, very importantly, how your patient rights, which underpin how you should be treated, come into play. Doing this education and preparing a care plan document is essential to establishing your care desires and ensuring that those caring for you truly listen and hear you loud and clear, with liability at the forefront of the conversation. Knowing your rights and finding confidence in your knowledge is the greatest protection and asset. So let's take a moment to go over the course outline so you have an idea of what is offered. There are 6 steps to this course. First is called Your Authority. It's about consent and the importance of establishing authority and sovereignty over your care, even if you're opting into the medical system. Then we talk about your rights and understanding what patient rights are. We talk about the system itself, how do medical providers communicate, and how are they liable? We talk about your desires, identifying your unique birth wishes in the framework of a birth plan. But this will go way beyond your typical cookie-cutter birth plan template. Then we look at the breakdown, detailing each of the 7 sections that I've laid out in a care plan document, and how those desires identified in your birth plan will fit in. Finally, you will confidently create your own care plan document to share with any medical providers or anyone in your care team. Looking a little deeper at each step. In your authority, we're going to look at consent details, implied versus explicit, passive versus autonomous decision-making, recognizing how your investment in heading your own medical care can reduce stress and trauma on the other side, stepping into the role of authority over yourself and your baby, and using intuition as your guide. Then we'll look at your rights. Why is it essential to understand your patient rights? What are these, and how do you leverage this knowledge to receive better care? Some examples of patient rights, and how to find out exactly which rights you hold, and how to seek further counsel if necessary, and the next steps if patient rights are violated. We will look at the system, understanding how medical personnel legally and interpersonally communicate. How is patient care communicated? And how are medical personnel held liable? To whom are they liable? And how does liability influence the kind of care that you will receive? Looking at your desires, exploring your care preferences in pregnancy, birth, and postpartum, making aligned personal choices, intuitive decision-making, and a brief look at human design and how that can influence your intuition, and developing a comprehensive birth plan to later integrate into your care plan. The final result will give you an editable PDF guideline to individualize your care plan and have an in-hand resource to provide to anyone on your care team, whether that is routine care or emergency care. Let's take a look at the care plan. Welcome to Module 1, Your Authority. In this module, we will discuss consent details, implied versus explicit consent, passive versus active decision-making, recognizing how your investment in heading your own medical care can reduce stress and trauma, stepping into the role of authority over yourself and your baby's care, as well as intuition as your guide. Let's talk about consent. Consent is a legal issue, which is why it holds so much weight within the medical system. If a provider does not obtain consent prior to caring for their patient, they can be held liable for poor outcomes, such as emotional or physical damages. Consent is primarily categorized by medical personnel as either implicit, which is implied, or explicit, which is clearly expressed either as verbal or written. This can become a gray area for practitioners and patients because legally, a provider can make decisions for you based on implied consent if they are not receiving clear, explicit responses. Consent is also categorized as active, which is ongoing and explicit, or passive, consent that is considered implied until opted out of. The difference between the care plan document and the typical birth plans you may see is akin to the difference between providing active or passive consent over your care. Providing passive consent is not the position you want to take. Let's talk about authority. This is where you have to make the decision to become the authority over your own healthcare. This is the work of stepping out of victimhood, stepping out of letting others make decisions for you, and refusing to take the easy way out by giving your power away. This does not imply that you need to know more than any medical practitioner on any given topic. This relates to being able to discern when to seek outsourced care, take in the opinion and advice presented to you, and make decisions that are in alignment with you, claiming authority over yourself and your healthcare decisions. The healthcare system is not set up for autonomous decision-making. Time is limited, staff are rushed, resources can be sparse. Workers are often overworked and underpaid, stressed, and this can leave them feeling calloused. They are not taught to confront their own practices on a deeper level, and therefore may have a difficult time seeing their work and the system from their patient perspective. Being presented with a patient that is stepping into the role of responsibility over their own care, who is aware of their rights and is making autonomous decisions, can be confronting for healthcare workers. This is just something to be aware of. Our goal is not to create a harsh dynamic of push and pull or you versus them. When you contract into the medical system and ask for their help and care, the goal should be to create a relationship or correspondence with equity and teamwork. You are within your rights, but unfortunately, you may need to stand up for yourself. I believe it is also important to recognize that there is risk involved with standing your ground in a system that is not set up for it. There are situations where women and families have been ongoingly harmed at the hands of the healthcare system, abused, mistreated, having their livelihoods put at risk, questioned, even finding themselves facing a system that may override their own power of attorney over themselves and their children's care. It's also worth noting that individuals that are in a minority or vulnerable situation can find themselves at an even greater risk. Benefits. Being self-responsible and making autonomous healthcare decisions reduces the probability of experiencing trauma or generational trauma, stress, regret, poor health outcomes, or unresolved concerns, coercion or feelings of manipulation, even distrust in yourself. When you are able to claim authority and responsibility over your health care, this quickly and naturally trickles into other areas of your life too. If you are prone to experiencing feelings of overwhelm and stress, taking control in this area can bring feelings of confidence and power in other areas too, such as within relationships, work, and self-improvement. Let's not forget that self-authority and autonomy does not end with pregnancy and birth. This is a lifelong role to step into for both yourself and your children. All the work you do in this area will benefit you indefinitely. After reviewing this material, I would like to invite you to take a moment to reset. This may look like getting up and stretching. This could look like shaking your hands out and your arms out, moving your shoulders, rolling your head. This may also look like a moment of breath work, which may include taking a hand, placing it over somewhere on your body that needs a little extra care, and taking slow, deep breaths in through your nose, holding for 4 seconds, and slowly releasing through your mouth for 6 seconds. Taking a minute or two to reset before we move on to the next module can be beneficial. I will find you over there. Welcome to Module 2, Your Rights. We're going to cover why it is essential to understand your patient rights, what they are, and how do you leverage this power to receive better care. Examples of patient rights. Finding out which rights you hold based on your location, and how to seek further counsel, if necessary, from patient advocates, as well as next steps when your rights are violated. The importance of patient rights. A thorough understanding of your rights as a patient will provide you with the confidence and knowledge to be the authority over your birth, as well as other healthcare decisions. You are less likely to fall victim to coercion, manipulation, or fear tactics, and more likely to maintain sovereignty over your birth decisions. So what are patient rights? They are a list of guarantees or assurances given to people who are receiving medical care. They may take the form of a law, which are upheld by acts, bills, or other aspects of government, or they could be a non-binding declaration from a facility or medical organization. Because many patient rights are upheld by government, you have the ability to use your knowledge of your rights to ensure that those caring for you uphold the patient rights too. Knowledge really is power when you're contracting into the medical system. Stepping into the power position. Asserting that you understand your patient rights, both verbally and in written form, is the quickest way to step into an authority position in your care while you are in the medical system. Again, this is not about creating a you versus them dynamic. It's simply you confidently taking the reins of your own care. Here are some examples. In general, as a patient, you have the right to receive safe and proper care, to give or refuse consent for any procedure for any reason, to receive thorough information about the benefits, risks, and options of the proposed care, to participate in healthcare decisions and healthcare planning, to ask questions and express concerns without fear of repercussions, to request a second opinion, the right to medical confidentiality, and to access your health information records. It is worth noting here that based on your immediate location, your differing country, state, or province, this information may change slightly. These rights are generally universal, but may be worded differently, as well as you will have more rights than just what is laid out here. We will get into this in a future slide. Here, I wanted to add some visuals of patient rights that have been written out by facilities. As you can see, the language used shifts slightly, but the overriding rights remain the same. These are just examples, and I would encourage you to look at the healthcare facility nearest you that you may be accessing, seeing if they have a similar template, or calling them to see if you can get a full list of the patient rights that they uphold. What about violations of patient rights? What should you be willing to do if your patient rights are at risk of or are actually being violated? Here's some examples. You can take down the care providers' names and report them to their governing colleges. This applies to physicians and nurses. You may choose to seek a facility patient advocate. This is something you can ask staff for. You may call a patient advocate hotline in your area that is not related to the facility you are at. You can report staff to their employers directly. You can choose to record yourself with either video or audio. You may choose to take legal action. Have it documented that they are violating your patient rights. And you can also speak with your local government representative after the fact. It's also worth noting the power that both the media and social media hold in keeping facilities accountable. The book symbol indicates that there is a PDF available. This should be used to deepen your learning. Patient rights are fairly similar all across the map, but they do have some variations. Searching patient rights in your particular area, I suggest that you start with your country for an overview, and then focus down to your province or state. Then, ideally, even the facility that you may end up attending. Use the My Rights PDF to document your findings. This is only a 5 to 10 minute exercise that will help set you up to be the authority of your birth experience in the medical system. These findings will end up being the backbone of your care plan. After each module, I like to invite you to do a quick reset before moving on. This may look like simply getting up and stretching. This may look like loosening any parts of your body that are currently holding tension, being mindful of our jaw, eyes, shoulders, stomach, releasing any areas that are feeling tense. It could also look like a quick breathwork exercise. If you feel called to take some slow inhalations through your nose for a count of 4 seconds, then allowing a slow release through the mouth for 6 seconds. Feel free to repeat this for a minute or two. I look forward to seeing you in Module 3. Welcome to Module 3, the system. In this module, we will discuss understanding how medical personnel legally and interpersonally communicate. How is patient care communicated? How are medical personnel held liable? To whom are they liable? And how does liability influence the kind of care that you will receive? Let's talk about communication. Medical personnel are primarily beholden to communication and instruction through patient charts, whether they be virtual or on paper, which consists of varying forms and documents that make up the guidance for that care for the person. This is where legal documentation resides and is the ultimate tool for communicating about a specific patient's care. Documentation in a patient's chart becomes binding and should be regarded as legal documentation. This includes all of your care. This is why your care plan document holds weight in the kind of care that you receive. Not only is it a thorough communication tool, it is also legally binding. Let's discuss liability. Medical personnel are highly attentive to what is in your patient chart because this is what binds them legally to the care that they are allowed to provide to you. By adhering to the documents in your chart, they protect themselves from grievances, disputes, complaints, and legal repercussions, and vice versa for not adhering to what is in your patient chart. Medical personnel are liable to their licensing college or institution, their insurance providers, their employer, and you. This is why it is so important and completely within your patient rights to step into an assertive position over your care, because they are liable to you. If you make it clear that you are the authority over your care and that you refuse to take a passive position. You should be aware that, unfortunately, most medical professionals see their patients at the bottom of the liability hierarchy. Their college, institution, insurance, and employer all carry a greater chance of putting their career at risk than their patients do. Your care plan document. You may consider having your care plan document signed by a healthcare provider prior to your labor or prior to requiring medical care. If you are already under medical care, this should be done at the antenatal appointments with your OB, midwife, or physician that is caring for you. Who else can sign the document? A trusted chiropractor, massage therapist, naturopath, or any other licensed care provider, as they are all part of your perinatal care. It is not necessary to have it signed prior to receiving care, but it does add more weight to the document and will likely result in it being more well received by the potential care providers later on in your care. This is especially true if you end up seeking care from providers that you have never previously met, such as going to a hospital. Because it is likely within your rights to be an active participant in your care planning, this care plan holds weight whether it is medically signed or not. And back to authority, taking a passive position can lead to experiencing trauma, coercion, manipulation, unwanted procedures, lack of acquired consent, or even physical, emotional, or spiritual harm. A reminder from the first module that taking an assertive position over your care sets you up to be an authority and decreases the probability of an adverse experience. Your goal shouldn't be to please staff at your own expense. You don't need to be a good patient. I invite you to take a moment to do a quick reset before moving on to the next module. Feel free to stretch or move your body, or consider doing a quick breathing exercise. This may include slow inhalation through your nose for a 4 count, and a deep exhalation through your mouth for a 6 count. Consider taking a minute or 2 to reset before moving on. And I will see you in Module 4. Hello, and welcome to Module 4, Your Desires. We're going to take a look at establishing your care preferences in pregnancy, birth, and postpartum, making aligned personal choices, intuitive decision-making, as well as the modality called human design, and developing a comprehensive birth plan that will later integrate into your care plan document. Taking a look at your own preferences, creating an individualized list of your perinatal preferences is an important aspect of planning, preparation in your pregnancy, your birth, and your postpartum experience. Identifying your desires and preferences doesn't indicate that everything will go to your exact plan, but it does assist in your preparations. Consider this. A typical birth plan removes mother's intuition from her experience, and it does place her in a passive position in her healthcare. Remember that you can use a birth plan template to derive some of your own desires and preferences, but that's really just the first step in initiating authority over your care. The next few slides, we can take a look at some examples that you could pull from the internet. Here are some examples that I found while searching. They are linked at the end of this module if any of them resonate with you and you think that they may help you identify some of your own desires, even just as a first step. Some women may already have a really good idea of what they want for themselves and their babies, while others may have trouble even knowing where to start in establishing their desires. This is where some of these templates may come in handy. So what's the best way to identify your own unique wishes? Here are some examples of ways that we can begin to identify our own unique desires for our pregnancy, birth, postpartum, the wellness of ourselves, and our babies. It really all comes down to intuitive work and self-discovery, and how you do that is completely up to you. Here are some examples: meditation, holding ceremony, intuitive self-questioning, journaling, reading podcasts and other informative resources, browsing birth plan templates like we reviewed before. You could also consult with an educated birth worker. You may choose to consult with friends and wise women in your circles. You can seek aligned prenatal classes. You can also observe the considerations for birth, pregnancy, and postpartum document that I have created. I also offer an exercise which is called the ideal birth. There is an audio associated with this exercise as well as the PDF that can be filled in. This exercise is a mix of meditation and journaling. Consider all the factors that will make up your experience, and you can begin to break down your preferences in a way that makes the most sense to you. You may want to think in terms of the individual stages of labor, perhaps the environment, emotional, mental, and spiritual and social factors. What about in labor and then post-labor, postpartum? You may also think in terms of the location or care provider, as well as the medical and non-medical side of your care. Let's discuss intuition. How do you, as an individual, get in touch with your own intuition? Well, with lots of practice, reflection, patience, and play. I do enjoy looking to the modality called human design, as it gives breakdowns of varying displays of intuition, and even if you don't adhere to or fully believe in the modality itself, the concepts can be quite helpful in your own self-discovery. Here are some ways that the modality of human design breaks down different ways of understanding your intuition. Some people have a sacral intuition, which is like a gut knowing. They're able to sit with the feeling and they can observe their body's physical reaction to yes or no questions, and it's quite physical. You may experience an intuition that's quite emotional. Your emotion overrides logic. You can take a step back until you feel really quiet and balanced. If there's emotions that are high, it can cloud judgment. Some people are more intuitive from an environmental standpoint. They may need to converse with their environment. They may desire a quiet environment to really hear their intuition, speaking to themselves aloud or with others, but not for their opinion, simply to speak. Others may align with an ego intuition, where their energy simply drops when it means no. There's also a splenic intuition, which is like a sudden knowing in your gut. It's an immediate response. You'll feel it. And if you wait longer, it will become less clear. There are also other modalities for your intuition through human design, and you can look into it more if it's something that interests you. Following your intuition has also been branded into various acronyms that you may see birth workers using for decision making. Some popular ones are the BRAND acronym as well as the BRAIN acronym. Both of these circulate through the birth work world. Personally, I really like a acronym that I came up with, which combines the BRAIN acronym but puts more of an emphasis on the actual intuition, emphasizing the importance of women going inwards for validation rather than seeking validation from an external point. The book symbol indicates that we have a PDF to work on. Now it's time to settle in with yourself and decide how much information you would like included in your care plan document, as your birth preferences will end up being the details within your care plan. Using the PDF, My Birth Preferences, to document your individual desires for your perinatal care. I want to thank you for spending the time to go through this information prior to jumping into creating your own individualized care plan. The next module will be a description on how to create your own individualized care plan, and the information presented in modules 1 through 4 will give you a really solid foundation to create that care plan. Please feel free to go back and review any parts that need a little bit more clarity, and I'll be happy to see you in the next module. After reviewing this information today, I would like to invite you to take a moment to sink back into your body, That may look like getting up and stretching your body, perhaps shaking your arms out, releasing some of the tension, being mindful of how you're holding your face muscles, your shoulders, your arms, your gut. Are you sucking in? Do you need to relax? Give your body a moment to reset. This can also look like some deep breathing exercises and just taking a minute or two to respect your body and sink in. Consider taking a deep breath in through the nose for a count of 4, holding it at the top for a count of 4, and releasing for a count of 6. Consider that breath a couple of times before moving on to the next module. Hello and welcome to Module 5, the breakdown. Here we will detail each of the 7 sections of our care plan document, as well as helping you identify how your individual desires fit into this document. Here is an overview. We will first touch on the main page, which identifies your own information, as well as an overview of some basic rights that you are entitled to. In my example, you will see that basic rights have been listed, and it's up to your discretion to change, edit, or add any rights that you feel are applicable to you. There is also an area for signatures from registered professionals, and it further identifies what kind of document this is. We will then discuss in detail the 7 sections of the care plan. These include your personal health and medical history, who you would like to label as your power of attorney, substitute decision makers, advocates, or support people, your allergies or sensitivities, your beliefs when it comes to religion and spirituality, racial and ethnic backgrounds, how you communicate, and an area for other information. Before beginning work on your individual care plan, I really suggest that you have in front of you your birth preferences page as well as your patient rights page that we would have downloaded from our previous modules. Both of these pieces of information will help you easily, quickly, and accurately plug in your unique information into this care plan. You can find the links to these PDFs if you have not already downloaded them below this video. You will also find the editable version of the patient care plan document. Let's take a look at the document itself. We'll start on the first introductory page. This is a basic page which will outline your personal identification information as well as the rights that are applicable to you. I have listed basic rights which will apply to most people, but I do encourage you to use the previous modules to indicate which rights are truly applicable to you, making sure that none are not applicable, as well as if you want to add any extras here, that is an option as well. You can see at the top that it's important to start this document off in a professional way. We are going to label your name, date of birth, and any health identification information. This could be a health card number or even an insurance information. Any information that you may see plugged in on other healthcare documents. Moving down, we can see that it's a basic outline stating, I have an understanding it is within my patient rights to be an active participant in the planning and execution of the medical care I receive, and therefore I am presenting my individualized care plan. From previous modules, we've learned that it is within your rights to be an active participant in your care planning. By starting off the document in this way, it's inviting your care team into the care that you have began to apply for yourself. This is also establishing that you are beginning to take an active role in your care, which we've learned makes for the best possible healthcare outcomes. Moving down, it states, I also understand that my patient rights include, but are not limited to, that staff must obtain ongoing, informed, and explicit consent, that you have the right to refuse any proposed treatments for both yourself and your child. You have the right to request further information regarding any proposed treatments. You have the right to seek alternative guidance, opinions, or care. You have the right to request all of your patient records documented during the course of your receiving care, and the right to receive safe, adequate, and non-discriminatory care. These are really basic rights that apply to almost everybody, no matter where you are. Again, use your own discretion and do a small amount of research to make sure that these rights apply to you. You can also feel free to add anything that you think is really pertinent to your own care, but we will get into more specifics and details further on in the document. This is just an introduction. Showing your healthcare providers that you understand your rights and are willing to speak up for yourself. Moving on, it states, I understand that my patient rights specific to labor, delivery, and postpartum care include, but are not limited to, the ability to move freely, the right to birth in whatever position I choose, the right to make all healthcare decisions for my child, unborn or born, the right to speak freely and openly without fears of repercussions, and that my child will remain under the direct supervision of a parent at all times. Once again, feel free to edit this section to match your own unique wishes and desires and your own healthcare preferences. Moving down, it states, documented within are important elements of my individualized care that should be reviewed by each care provider as part of your overall plan of care. This document is to be viewed as an official part of my patient records whilst receiving care, and is to be placed in the appropriate location. This could be a patient chart, a nursing board, your patient room, or anywhere else that designated staff want to see your information. This allows for ongoing care provider review. There's then an area that's identified for signatures, one of which being your own as you are an active participant in this care plan. The next would be the signature of the staff that's receiving the document when you give it to them. This could be an intake nurse, perhaps at a midwife appointment if you're working with one, at an obstetrician appointment. This could be much prior to actually going into labor. This could be signed at any kind of prenatal appointment, and then you actually have somebody on file who has reviewed this with you, understands what your desires are, and is willing to work with you. In previous modules, we discussed that it's not necessary to have this document signed, but it does give it a little bit more backbone and could release some tension around another care provider receiving it that's a little bit more hesitant to read it and work with you on it. By seeing somebody else's signature on the document, it can hold weight. There's also a section for other document acknowledgments, such as chiropractic or another holistic or alternative medicine practitioner. Anybody that you have been working with through your pregnancy that holds a designated title, you could ask them to quickly go over this document with you and acquire their signature as well. Another aspect of requiring someone to get this signed is the conversation that can open up between you and the people that you are assuming as care providers. This could lead to perhaps edits in the document itself, or even adding more information than you originally had as you work with your care providers to establish a care plan that is just right for you. Let's move on to the individual sections. First is the section which is probably going to end up being the biggest, which is your personal health and medical history. This is a very factual section and doesn't have a lot to do with your previous birth plan preferences, but it does have an important area for listing all the previous history for your medical and health-related concerns. One section is used for the facts, which is your history and dates of the medical history you have, and the other section are the details that are pertinent to your care provider. This can also be known as the non-negotiables. This is information that they must understand in order to provide adequate care for you. So here's some examples of what I have written here. This person has experienced asthma, which was managed with inhalers from 2014 until now. They've had a traumatic birth experience with some pelvic injuries, explaining that they were second-degree tears and an instrumental delivery in 2020. They've experienced anemia in 2019, which has since resolved, a miscarriage at 13 weeks in 2018, appendicitis, including a surgery called an appendectomy in 2016. They had a live birth of their first child. It was via C-section with no complications in 2015, and they also labeled trauma due to sexual assault in their youth in 2009. So this is all obviously pertinent for a care provider to know and understand about this person's past in order to provide them competent, safe, and adequate health care. But the really important part is what we label on the other side, which are things like, I'm going to require trauma-sensitive care because of my past. I will require explicit verbal consent, which must be obtained before touching my baby or I. Explicit verbal consent must be obtained before providing any test, procedure, treatment to my child or I. And I understand my right to refuse any proposed test, procedure, treatment for my child or I. This is not a list of preferences. This is a non-negotiable list that your care providers must understand and respect. Based on your previous health history, this might look a little bit different. Maybe these details will still apply to you, or you may have more details to add. If anything is not applicable, you can remove it for yourself. Moving to the next section, which is your power of attorneys, substitute decision makers, advocates, and support people. Depending on where you live, these labels may change slightly, but they're all essentially telling your care provider who is making decisions for you in the event that you're not able to adequately make decisions for yourself. So here we have labeled a spouse as a power of attorney and substitute decision maker, a woman as her doula, which is going to work as an advocate. Her mother and her sister are going to be support people in her birth environment. Those are the details that are important to know as a care provider, but on the other side of this box are the details, which again are the non-negotiables that the care provider must understand in order to provide adequate care. It states, in the event that I am unable to advocate for myself, whether due to being too involved in my labor process, because we know that in physiological birth we are in an altered state of mind, especially deeper into the labor process we go, or if I become incapacitated, please refer to my entrusted POA, substitute decision maker, advocates, and support people for decision making. I've added the caveat, do not defer to medical staff to make decisions for me before consulting the persons listed here. This is going to change from person to person based on what your wishes are. Some people will believe that the medical staff do have their best interests in mind and therefore would be able to make substitute decisions for them in the case of an emergency or if you became incapacitated. But if this is not your wishes, that even in an emergency situation, which could be life or death, you still would prefer your own substitute decision makers to make decisions for you, here's the place to list that. As long as a care provider has this documented in writing, it covers their own tail. Because as we've learned in previous modules, one of the biggest concerns that are the top of mind for care providers are abiding by their policies and procedures. Our next section is for allergies and sensitivities. On our known reaction side, we have this person listing penicillin, which gives them hives, and Tylenol, which they simply have an adversity to. On the details side of this, which is our non-negotiables that healthcare staff must understand, it states, I will require a thorough explanation of any contraindications and potential adverse effects, which is our benefit and risk analysis, of any proposed medication, tests, or procedures, and this also includes anything that is considered generally safe. Unfortunately, the term safe has been thrown around so much now that some providers don't feel that it's necessary to give any further information on medications, tests, or procedures, or even bother doing a benefit and risk analysis. So I believe that this is an important caveat to make. It also states, I understand my right to refuse or seek more information about any proposed medication, test, or procedure. Again, this is just reiterating that you understand your rights around tests, procedures, and medications. This area can also be used for known or suspected allergies or sensitivities, which can help you to steer clear of tests, procedures, or medications that you really just don't even want offered to you. Moving on into the religious and spiritual section, This person has some practices listed below. They have some newborn rituals that they perform, such as a prayer and a ceremony directly after the birth, and therefore they would like the room to be kept calm and quiet. They want to do delayed cord clamping for a baby's umbilical cord. They want it to stay attached to the placenta until the cord is completely finished transferring blood. An immediate skin to skin where baby is not to be wiped clean, the vernix is to be left intact and not to be removed from baby without explicit consent. And they want any wellness checks to be delayed and for both baby and mother. And they also want the baby to be on mother if possible while performing those checks. They're interested in a lotus birth where the umbilical cord is not to be severed at all until it naturally releases by itself as it dries. They do not want any narcotics, including an epidural. And they also believe in prayer and meditative practices, asking for a quiet, calm, and private environment. They state that is necessary. And they want to also ask staff to provide privacy at any time during labor, birth, or postpartum. As we can see, this area listing the practices is really a request section. This section particular doesn't have anything to do with rights or liabilities. This looks a little bit more like a birth plan might. So this is a great place to start plugging in the things that you've identified on your unique birth preferences, as well as postpartum preferences. And what you'll see is that on the other side of our details, our non-negotiables, what really hold power in your experience are going to be that your medical staff that are providing care need to be respectful of your religious, spiritual, and cultural practices to ensure that you receive culturally compassionate care. It also states that you must be notified of the contents and ingredients in any medications to ensure that they're in alignment with your values. And it's just stating that natural physiological birth is what this person is desiring. So clearly, this part looks a lot different than a typical birth plan does. Though we have what our wishes and desires are listed here, it's not at all telling staff that all of these things must be met in their birth experience, because it's simply unrealistic to be hard and fast expecting that every detail that we want done for ourselves or our babies is going to come to fruition. But what we can ensure is that these wishes are identified, and that on the non-negotiable side of information is that the medical staff should be aware that they're being respectful of these wishes, of your religious, spiritual, and cultural practices. They must ensure that they are respected, because that's how they're going to ensure that you get culturally compassionate care. So it's less about a care provider ensuring that you get all of these things, but it's ensuring that your care provider is respectful of your wishes, allowing you to ask for these practices to be done in real time and have them respected. Moving down to our racial and ethnic background. This person has listed that as a person of color, I recognize that statistically I'm at a greater risk of experiencing poor maternal and fetal outcomes, and will therefore be a strong advocate for myself and my child. I think that this is a really important point to make for those people that are of color or of the BIPOC community. Sometimes simply stating the facts that you are of a greater risk of experiencing a poor outcome to your care providers can just bring that top of mind for them and help them be a little bit more aware. This is not meant to be confrontational. It's just meant to start to harbor a little bit of empathy towards you. This can also be a way to open up great dialogue with your care providers. They've also listed that their husband is to answer any medical questions on their behalf. There are cultures where the woman birthing would not be answering questions for themselves, and it would defer to their substitute decision maker or their husband. That is just culturally appropriate for them. So this would be an important place to label something like that. It may also make a person more at ease to have a multicultural care team, and depending on where you're birthing, that can be arranged if it's something that will make you feel more at ease and comfortable in the birthing process. Again, a lot of the information that you put here can just open up really great conversations with your care team, and I hope that it's used in a way that's not confrontational, really just to get to a place of mutual understanding. Over on the details side of this section, we are going to specify that we understand our rights to receive culturally appropriate and compassionate care. We're also going to describe that we understand our right to receive safe and adequate health care, irrespective of any cultural, ethnic, or racial backgrounds. These details are non-negotiable for our care. Moving down is the section for communication. Now, this includes things like visual aids for what kind of impairment you might have. This could also be hearing aids as well. This is a section to put what kind of learner you are best. Some people are really visual learners, and they understand best with the use of visual aids, including diagrams and written information. A lot of information can come at us very fast in the medical system, and just putting this down that you're really not going to fully understand information unless you're able to sit down with it either in writing or diagrams written out in some way. Really puts at the forefront that you cannot give fully informed consent if you don't understand the information being presented to you. So please be clear. If you want information to be laid out very clearly for you in writing or even where pictures are possible, this is it's super appropriate, especially for those that don't come from a medical background, and should be completely respected because, again, you cannot give fully informed consent unless you're able to understand the information that's given to you. You can also state here that you're going to require time to consider the information provided to you and all of the options that go along with making that decision. I think that this is an important piece of information to have for anybody because it just reminds care providers that it takes time to make a coherent and aligned decision for ourselves, and that if we do ask for that time, that it is respected. And over in the details section where we have the non-negotiables, we're reiterating that we understand our rights to request more information, request another care provider, seek alternative options, and take as much time as necessary to make a decision regarding my care. It is pertinent for your care providers to know that you understand these rights. Lastly, we have a section for other details, things that maybe don't fit perfectly into our other categories. Here I've labeled that we have a dietary restriction as the person is vegetarian, and also just stating that they'll be working to exclusively breastfeed their child and that they would like guidance and support in the area as much as possible. Anything that's left over on your identified birth and postpartum wishes list can go in this section if it doesn't fit neatly into another area. And this is our entire patient care plan. So I hope that you can see if you've taken a little bit of time to identify your own unique preferences both in birth and postpartum, and you've taken a little bit of time to do your own research on your patient rights in your specific area and at the location where you plan or may end up experiencing care, then really everything just kind of plugs into this patient care plan here. I really want to thank you for taking the reins on your own care, stepping into a role of autonomy, because it's the best way to ensure that you receive safe, adequate, competent health care. Whether you are pregnant, going into your birthing season, or in your postpartum, whatever care you're deciding to seek, you deserve that kind of care for yourself and your baby. This has been the Birth Sovereignty in the System course offered by myself, Sondra Reher. I really hope that you have either learned something, enjoyed part of this course, or figured that you would fully take on the role of stepping into autonomy and creating your own patient care plan after reading through and taking all of these course modules. My goal is really just to help as many women as possible have an ideal birth experience with whatever decisions they want to make for their own health care for themselves and their baby. Thank you so much, and I'll see you again. Have you completed all 5 modules in the Birth Sovereignty in the System course and are looking for a little bit more guidance in completing your patient care plan? Well, I'm happy to share that I can help. While all the resources are free to download, including the patient care plan itself, your birth preferences sheet, as well as your patient rights PDF, I also know that there is a gap that some people may want to be filled with a little bit of a helping hand in making sure that they're filling out their patient care plan to their fullest ability, that they're understanding exactly what the patient care plan means, that they feel supported in providing the patient care plan to their own healthcare providers, and they may be looking for their first initial signature on having a registered staff look over their document with them, have a prenatal appointment, and sign off on it. If this is something that's of interest to you, I will be women to work privately one-on-one so that we can in detail go through your own care plan with your own healthcare information, making sure that's exactly what you want it to be and that you feel confident providing it to your healthcare practitioners. This is absolutely not necessary unless it's something that you feel called to do. You can find more information in the links below this video, and I would be happy to work with anybody who's needing that extra bit of support after completing this course. If that's you, I'm looking forward to hearing from you.